listen to what your heart says. Do whatever you want that makes you happy and stay in it. For me, for the current generation, my one mantra is given it. Jo dikhta hai wahi dikhta hai.
Thank you so much for coming down to the Kanya offices. We are very lucky to have the Palkar family, right? And a rarity that, or maybe not a rarity, a family of doctors. So let me start by asking, right? I think this is very, not so like secret, right? That doctors marry doctors, they have kids, they marry doctors. So how did this happen, Siddhant? Any motivations? How do you all feel about it? That's becoming a doctor. Any general thoughts?
Right. So I think doctors marry doctors. Yes, we are highly compatible. We were batchmates. So we
Where?
at JJ Hospital.
Okay.
So we did our undergraduate MBBS from there. So that's when we met and fell in love and married. So I think we had, during our academic years, rigorous and long hours of study. And then after that, for the postgraduate also, we had on calls, which were again long. And then, of course, as we went into practice, patient responsibilities became even more. So I think we understand each other's work schedules pretty well by now, all over the years. So I think understanding between us is very important to maintain that married lifestyle happy.
Yeah. So I think it's always been hectic. Moment has always been hoping since the start. There have been days that dad has not been there at home. Even he got to sleep in the night. I've not seen him. I woke up in the morning again. I've not seen him. He slept before I woken up. And there have been days that he's come to school and teaches us, who is this person who's here? And that's my father, and he's not been there for many open houses. But mom, I must say, she done a lot for us. She's always been there when we wanted. She used to come in the mornings to drop us, go to the hospital, make sure she comes back on time, initiate to run, and say, tell the teacher I'm coming, ma'am, on my way. She's come, she's picked us up, taken us back home, cared for us. And I think, I'm grateful to have parents like these who, even after looking after patients, they've never left anywhere they've, taken in our childhood or growing us up and coming to adulthood. There's been any lack of care from either of them. So I'm very grateful to have parents like this.
And, now that you all see a little bit of the MBBS today versus the MBBS many years ago when you all were doing it, what has changed?
During our time, it was more of secret clinics. We used to go to the ward. If you had any doubts, you used to ask the doctor in charge or the registrar there. And I remember going to the Xerox center and Xeroxing all the notes. That was then. But now, at the click of a button, they get PDF files, they get notes, they get to see the videos. We used to go more to the clinics. Not that these people don't go, but here's something, whatever doubt they have, it just comes at the click of a button. So I think now this current generation misses out on the practical hands-on knowledge that we were, lucky enough to get it. So I keep on telling these people, go into the wards, go see patients. But the advantage they have is everything is at the click of a button. They don't have to carry those heavy books. One cell phone, one laptop, and then can.
They have a lot of YouTube videos from which they learn. So as rightly said, we were hands-on. We used to go to the, cadavers, see, go attend, see to, how the clinics, get lectured by senior consultants, their experiences. So you also, see the specimens, go and do practicals. So it was very much hands-on, used to interact with our fellow students. For them, I think, it is the social media has made them very aware of what's happening in medicine, both domestic as well as internationally. So they know what's happening, to the Royal College of Surgeons because of internet, because of social media. They're very much smarter. This generation is much smarter, in their profession. They know exactly what's going on. But for us, it was very simple and straightforward. Textbooks, lectures, practicals, it's like very hands-on. We used to ask our seniors, I present the case to you.
Life was simple.
Yes. So it was very straightforward, and very much hands-on.
So what advice would you give Siddhant today and maybe younger medical professionals?
So I think you have to have a plain the book. Yes, so that's why we teach them, what we have experienced over the years. So I make sure that, he actually attends the practicals as opposed to, maybe just seeing YouTube videos, actually presents cases to his, bosses. If they have free time, I've told them, go and open the case note of a patient and see what exactly is how they have arrived at the diagnosis. Maybe you can also check him out. Yes, how they have investigated.
Right.
So all this is a learning process. But that learning process, what we did, is very important. And that's what we teach them, that, how we have learned medicine as what you must also do. We are not against the social media. I find that's very good. This is a distraction also. But it's amazing the amount you learn, and the global space has just become so closely knit. It's extremely useful. Siddhant telling you so many things which I wasn't even aware of, even now or even as a medical student.
If I may, doctor, how is it being a woman in medicine? Right, I think particularly the very long working hours,
Yes.
childcare,
Yes.
multiple responsibilities. We heard from Siddhant that you would pick him up from school, somebody
Yes.
drop him to school.
Yes.
So advice to women in medicine today.
Yes, so it's not easy, but it's not impossible. It's a tightrope to walk. And, I think when doctors are planning to, increase parenthood, they must be mentally and physically prepared that it's going to take a lot of effort, a lot of sacrifice. Once your mind is set, half the battle is won. Things go easier from there. I think sharing of responsibilities by both parents in today's, it wasn't there during our time. Men were still men. And I allowed Vikas to, go ahead with this practice, never interfered in his work. I took a back seat, so that was 10. And I took a back seat and looked after the children. And I'm not being judgmental, but that was my thought, my perception, that I wanted to be with the children. I'm not going to leave them to domestics. I think I don't regret that even for a night. That's me, that I managed. So what I did was I kicked my career, worked for some time, then again took a back seat, looked after the children when they went into higher academic years, or when they were a little younger, when they were tiny kids. That's again when I took a back seat, got back to medicine, took a back seat again for the academic years, and then again got back to medicine. So it's not been easy, but one impossible. So if you are, if you're determined to do it, you can do it. Today I'm back into full-fledged practicing at the stage.
Incredible, with no regrets.
Yes, no regrets. Both my children are doing medicine.
Wow.
Yes,
Incredible.
so Siddhant is in 3rd MBBS, part 2, and my younger son is 2nd MBBS.
Wow.
Nothing.
Quite the story. Quite a story, and inspiring one.
It's inspiring, absolutely.
One of the bigger motivations for us to, start Knya, right, Manchika and me, was that we feel that doctors and nurses are incredibly underserved, right? And when we kind of double click into the medical professional's life, we see there are a couple of areas, broken, right? We see obviously there's a scarcity in the number of doctors in tier 2, tier 3 cities. We see there's doctor violence that could be from maybe miscommunication, maybe long hours. It could be various reasons, right? So would love to, discuss some of those important points here, particularly to do maybe with like toxicity with seniors and juniors, right? I think like many professions, medical professions is an apprenticeship business,
Yes.
right? Where you have a senior consultant who's guiding maybe a junior doctor maybe guiding somebody else.
Yes.
And that's all the way starts from an MBBS final year to maybe an intern,
Yes.
right? So would love your thoughts on kind of why does this exist, this toxicity in like between seniors, juniors, and some experiences that maybe you all got affected by this, and if not, maybe you all had some great seniors who supported you as well.
It's a very sensitive question, and I think during our time, this never happened. But the current generation is a totally different scenario. We were all from Mumbai. Most of us, 95% were Mumbai. We knew each other. It was from the city itself. But now, with the NEET examination coming up, you get people from different states coming in with different cultures. So again, to me, it is communication. The more you communicate with your senior, the more you leave your ego aside, it will get a good rapport between. The starting point has to be on a mutual understanding. Once that is not there or it is broken, then the problem starts. And it goes on to escalates to different level. First level, second level, third. First will not talk to the second will not to the third. So if that communication is there, then I think it's an easy.
In this session, it's there. The toxicity exists. No one saying no, it's not there. But always steps that said, you can come to overtake them. So when we came the first year, we had our seniors were there, not their second year. They used to come and they used to approach us. It's always mutual. You have to approach them, and sometimes they will come to you. Yeah. And I think that typical ragging that was there in medicine, it's still there, but maybe less as compared to what my parents had. So I think the toxicity gap is only reduced when you and you also have to give some. So I think a certain amount of respect that they are seniors and they too also look after. These are my juniors. We've also been there at one point. They were also in first year, and now maybe they're in the second and third year. So I think once you have that mutual understanding and admiration and care with your seniors and they have for you, then I think the toxicity doesn't exist anymore.
It's more of mutual respect.
Yeah. Okay, thank you for sharing that. There's an interesting statistic, right? 75% of doctors get attacked at least once in their professional life. Have any of you all faced that? 25% the breakups?
Yes. So am I. We've never faced that. But we feel strongly about it, that this shouldn't be done. There should be a law, that, if a doctor is, violenced, then, just like anything else, we feel strongly that there should be a law for that. And it's unacceptable. A doctor never does anything intentionally. So always in the best interest of his patient. And if something happens, it's just sorry for that. But, we never mean any harm to the patient.
It's always done in
always in best interest of the patient.
In faith.
Yes, in good faith. So, we should not be, attacked for that.
Yeah. No, of course. I think that goes without saying. Anything that you recommend that maybe institutes, private, public, government can take up to reduce this? Because it's appalling, right? I mean, at Knya,
yes,
it's not even a conversation of attack, right? But in fact, it's 75%, right? That's an absurd number.
Yes.
Right? But yet, in some sense, it's prevalent and it's happening in some sense in a ubiquitous way.
I personally feel the government should take up some sort of action in introducing a subject called communication in the first MBBS. Communication, because sometimes it is not only the patients. Doctors are so hard pressed for time, they don't talk. If my relative was there and if I am waiting there for 24 hours just waiting for the doctor and he talks to him for 30 seconds, maybe I also would behave in that particular manner. So I think for them, communication has to be taught from first MBBS. Anatomy, physiology, biochemistry and communication. Next year, pharmac, physio, micro, again communication. So that thing, if you, from our side, we are in the center. Patient is on that side, we are here. So if we make this juniors teach, maybe they'll come a little towards the center and then get the people, the public also towards the center. The both can make a vision model.
I think I would just like to add to what Dad said. I have an exam question that comes every university exam saying that you have to have a question on consent, a question on communication, on medical ethics. So I think and this was what senior doctors in our college always said, that if a patient dies and you tell their relative, you communicate with them how he died rather than saying, I don't know how he died, I'm not dying for this, they will get violent because they're in an emotional state where they don't know what's happening. But if you communicate, you communicate well with them and you communicate when they understand in simple words why that particular incident happened. Because as I said, no doctor doesn't intentionally. We are all here to care for the community and make sure the patient's life is safe. So once you communicate properly to the patients, relatives that what's happening, they understand and they will not, attack doctors as what's been prevalent.
Such a powerful, I think, conversation, right? So I was talking to I'm lucky enough to talk to hundreds of doctors every week, right? And one of the common theme among young residents is that if a doctor meets even just can spend even 10 minutes with one patient and they feeds each other, they're meeting almost 100 patients in very busy OPDs, right? So I think communication is so critical. at Stanford, I ended up taking this class called Managing Difficult Conversations. It was cross-listed with Stanford Medicine.
Okay.
So where it was like MBA students with medical students, literally learning how to break bad news, how to kind of set expectations, how to not beat around the bush, just be super direct, exactly what you were saying, right? So I think it's such a powerful conversation. So I'm glad you mentioned it.
We also have started in most of the corporate hospitals. There's a special room, there's a counseling room, there are video cameras. You make them sit on a proper sofa. It's not like in the olden days, we used to just tell them in the corridor, this and this. And now you make them sit, the family comes, a consent is taken. So we are also moving. Give us some time.
Amazing. Oh, that's another interesting statistic, right? So 61% of patients end up searching on social media or the internet before visiting a doctor, right? And now both of you have thrive-in practices, but it was a different generation, right? Today, more and more, the value of a personal brand has become critical, right? So Siddhant, how do you think about it, right? Because you'll be building a practice in a very different age than your parents did. Where yes, word of mouth is important, but social media, communication, your brand is also important. So more than just being a good medical professional, you got to also learn the art of kind of marketing yourselves. So what do you think of that?
So I think in today's generation, it's very important to have a social media presence, because I've seen, I've spent time with senior consultants in their clinics, and I've seen, when they ask, so all doctors, all the consultants, all the other patients, who gave the reference? Did you come on your own, or who did you give the reference? So they said, no, sir, we search your name on Google, we search your name. We saw on Instagram reel of yours that you put down when you spoke about this particular disease. So, we thought we come and show it to you.
Mm-hmm.
So I think, as you said, 100% is true for our generation onwards to have the social media presence and have the skills of marketing and letting the patients reach, and not just reach, the ones who have Instagram around them, but, use YouTube or any other forms of social media to let it reach the patient to understand, I am a doctor, what my specialization is, and in simple words. And if you tell someone that I'm a cardiothoracic surgeon, a layman, understand, but, the doctor of the heart, you have disease of the heart, you tell them in simple words, and you explain to them, I'm sure, it'll help build your social media presence and help you increase your practice down the future and you start practicing medicine.
Now, any thoughts on...
For me, for the current generation, my one mantra is given it. Jo dikhta hai wahi dikhta.
I think I'm also of the old school of thought. I really don't like the social media. I prefer my actions to speak for themselves. And, the old way where the word of mouth and, and I think the social media, being on LinkedIn or, staying and you're putting a profile, makes patients shop.
No.
Shopping around, which I don't know. As I said, the old school of thought, I really don't like that shopping around.
Yeah.
But that's what patients do.
Yep.
Putting your consultation charges and, doctor will take this much, I don't know, I really am not too fond of that. But then that's how...
I have a balanced approach.
Yeah.
I take a balanced approach.
Any thoughts on this? Like what your mom said, Siddhant?
So I think, as in the old school of thought, but no, it is
It takes a bit of part.
No, but it is important, to have a presence. That's why hospitals also on their websites, they put up the doctors and, put up the slots and they put up information, the qualifications. So, the patients saying more the qualifications, more the successful doctors, and they probably easily take my disease. So, it is important to have that presence of a website. All doctors that I know, at least the younger generation of consultants that I interact with, they all have websites with their attachments and, their degrees and their achievements. So that's important for the patient to know that this doctor is established.
Same like jo dikhta hai wahi dikhta.
It's a very famous saying in FMCG, so that's basically what they say, that's what distribution is, so it's really amazing. So Siddhant, how are you thinking about your future, looking at your parents, your successful practices, gone on very different parts of medicine? What are you thinking to do? Have you any plans, any aspirations?
So as of now, I haven't, fixed my mind on a particular branch. As I'm learning, I'm exploring, there are different branches that come up, at one point it may be, I'm with surgery, at one point it may be medicine. So I think that eternal battle lasts the time I give my entrance exam and, finalize on this particular branch that I think, I will do well in it and that I love. I don't want to take a branch just because, people say that rank medicine is a high rank, so I want to take medicine. If I like a particular subject that may be lower on the rung of the ladder, but if I like it and I, have my interest in it, I will surely pursue it. So still exploring in those stages, but yes, I will decide on a subject that I have put my heart into, and I know I'll be successful.
So I would advise Siddhant that, take a line that suits your personality. That's very important. Someone may be extremely dynamic, wanting to stay awake all night, then you take a line accordingly.
Time out. I tell you, for me, it is, I keep on telling you, like I told him, listen to what your heart says.
Yes.
You listen to it. Just because you're getting radiology or surgery, if you don't like it, don't take it. You will be unhappy your whole life.
Yes.
Do whatever, work whatever makes you happy. Remember one thing, the heart is on the left, but it is always right. It's always right. Then later on, you don't want to repent in like, "Arey, mujhe karana paiye, arey aisa karana." Do what your heart says. Don't listen to anybody. Only listen to this gentleman here. And you'll be happy. And that is what you want in life.
Yes.
Any reason why you picked oncology?
It's a long story, and I picked up oncology because of her. She built in my form.
So you are following your advice.
No, but how's your heart?
She's your heart for you.
This one is
You're welcome. Go ahead. Yeah, sir. We love the story, but a shorter version of the story.
shorter version of the story.
Yeah.
She had failed in my form, and I was ready to do because my marks were not, up to the mark that time. So she failed in my form, which I never knew. That's how I entered Tata Hospital. So I think that's why I said you should listen to your heart. Yes, because I think of oncology.
And no regrets.
No regrets, absolutely not.
So he's an excellent surgeon. So that skill is all in him. He has the same years as his grandfather.
I'll never stop at the years.
So that's genetic. So he's very lucky that I filled the form. That was destined. And he really blossomed and did very well for himself in this branch.
Amazing. Thanks. Good. And why did you pick your particular?
That's a long story. For me, it wasn't so easy. That's why guidance is extremely important. So initially, after I finished my MBBS, I wanted to do surgery. It was just glamour of being a surgeon. Oh yes, I'm going to cut and chop and, I'm going to earn money, And that was, when I was Siddharth's age, all very, raring to go. And then after I finished my MBBS, so that time we had the postgraduate seats given to us depending on the third MBBS marks. But after MBBS, my mom told me, you are a lady. Do you think as a surgeon, you would have patients, coming to you as a lady surgeon? And that set me thinking. And then she said, why don't you take up obstetrics and gynecology? So I changed OWQ, but little did I realize that I didn't want to belong on boards. I don't mind staying away at homeland, but it should be under my domain. So suppose I'm back at home, I sleep at 3, I get up at 6. But those 3 hours are mine. They should be under my control. And it wasn't so in obstetrics, as you know, any time the patient comes in labor. The second thing is when the children, I never thought about all this, you see, there was no one to guide me. When I had my children, then the whole mindset changed. I said, no, I want to take care of my children hands-on one, single-handedly. I want to do everything for them and not handle them over to even a domestic.
Right.
So then obstetrics is again out of the, basket. So then again to change my line, something so that I could take care of them, also practice and gain flexibility of time. And so again, I did a fellowship in fetal medicine.
Wow.
And that's how it was a very rough role. God was very kind that, I got a chance to be a visiting consultant to Dubai, which gave me a lot of exposure to varied cases, interesting cases, name and fame.
Wow.
I was like Vikas always as an international khiladi. If you get this opportunity of going every month to Dubai, seeing the varied cases, so it is extremely satisfying also. And like I said, for radio talks, giving lectures to, a lot of doctors in Dubai. When I did this, there were not too many people in fetal medicine. So I think I had it good. But after a lot of trouble, but I didn't give up.
as they say, right, the path to success in every straight one.
Yes, correct. So that is why I tell Siddhant, the guidance is important. He's lucky to have doctors as parents who will, tell him where we went wrong,
No,
our life's experiences, so that they will make the same mistake as he did.
no, I find it interesting you said this, right? So, there's they famously say, right, that it takes 14 years of trial of vanvas to really become a doctor, right?
Yes.
And you have obviously MBBS, an internship, then residency, then specialty, then school specialty, and it doesn't end. Right? Always studying, always getting better.
Yes.
So what advice do you have for somebody like Siddhant, right? Because clearly there is a underlying advice of patience here,
Yes.
right? There's an underlying advice of struggle here, resilience here,
Yes.
right? Any quick stories, any quick piece of advice for Siddhant's generation?
So I think, there's a lot of stiff competition today. There are multiple levels of exams to be given. I think, he should take up a line which is swift, a short period of time, and then, start practice. It's very easy to say, but maybe difficult to do. Because, with all the examinations, you may not, get the speciality of your choice. You may have to repeat it again. So yes, as you said, it's a path, but, we hopefully want to guide in the shortest way and getting into practice. We don't want our child in the same, as you rightly said, neat PG, super speciality PG, too many exams, too many obstacles, you don't know where you're going next. No. Then we want to guide him, so that he does it in the shortest possible way
No.
and starts practice.
Yeah.
I want to see our child settle soon.
My advice to him is do whatever you want that makes you happy and stay in it. And you have to serve, you have to give back to the community. If he feels tomorrow he wants to go to the interior parts and once a month, once a week, whatever it is his choice, but you cannot study here, learn here, and then go abroad and settle there. You have to be in India, wherever you are. You have to come back to your motherland. And this is one advice I keep on. It is their choice.
Yeah, I watch the same. I love my country. Very proud of it. And I think, they should serve the country.
I think it's such an incredible thought, right? I think this is India's century, and I think we owe it to our communities, right? To the motherland, right? And we got to serve the motherland. And it encompasses all of us. I think COVID-19 was a wake-up call, not just for medical professions, but for everyone around, to realize the hardships that medical professions face and why we need to take care of our doctors, nurses, technicians, right? And so I really, really appreciate you saying that. I think it's a very noble thought, and I think, we all. One last question from my side, which is a bit linked to this, right? Today you're hearing thousands of nurses leave India,
Yes.
right? And I do believe, as a medical professional ally, that nurses are a backbone to the ecosystem, right? But sometimes they don't get the due, right? And firstly, they don't get the doctor name. They often kind of get mistreated by patients. Respect. So as senior consultants who have thriving practices, who probably have many nurses working with you, what are your thoughts? Why does this happen? How do we fix it?
Education. The education level. So I think, being educated, we respect even the domestic house. Why not the nurses? They are, they are part of our team. So, it all depends upon your mindset, how you, think that the opposite, every person should be treated the way you want to be treated. So, I think, and that's where probably, people who are, several rungs below in education think that nurses are, they are inferior. So we can, maybe...
Why only the nurses? Because I think the entire paramedical staff that is around them, right from the nurses to the OT scrub nurses to the momshies to the boys, supervisors, everybody. It's a whole team. And I think we should have some sort of a system where their families are looked after so that they don't have to leave the country and go. It's all a question of money, vitamin M. Why do you think they keep on wasting? If you are not funded well, they come from poor background. They have to fund their families so they come. We should try and get something on board for them. It's not that give it on a platter, but they should also have some incentive to stay back.
Incredible. I think this has been such a phenomenal conversation. I've learned so much as an entrepreneur. Obviously, the role is very different, but I feel that it's analogous. It's analogous, right? I think there are so many parallels to, so I think the incredible learning opportunity for me as well. Is there anything else that you maybe like to ask me, or maybe anything that we'd like to share that maybe I've missed out? Or
So why Kanya? Why the name Kanya? Is it a short form for the girl child? And Kanya?
It's a short form for the word Panchakanya, which is a Sanskrit word for goddess of courage. And what better profession to describe courage
Yes.
than medical professionals like yourself?
Okay, wonderful.
Yeah, and a brand that obviously we're very inspired by, Nike, which is the Greek goddess of victory,
Okay.
right? The name Kanya obviously came by my co-founder, also my wife, Manchika. Yeah, she's the real deal. Yeah, she's the real deal, and so that's where the name Kanya came, and it's a name that's obviously very close to our heart, and now hopefully is ubiquitous with scrubs in India,
Yes.
and hopefully one day.
Sure, yummy.
There was a real pleasure. Anything else I can maybe answer, or anything else you'd like to share?
I would, as a doctor, you asking the last question, what they might keep on telling for the junior batches especially, then whenever you are being out, just keep your eyes, ears, and your nose open. You have to see whatever you're seeing in the ward, patients, in the live, saline bottle, water you're seeing. Smell, your nose has to be, you see, when you open a wound and see an anastomotic leak, you can smell bowel there, you can smell. So I keep on telling you, your nose has to be open. In the theater, if you burn a thyroid gland, you get a particular smell. Once you know that smell, you'll never forget in your life. And your ears have to be open. Listen to whatever it should be. To become a good surgeon, I feel you have to be a good observer, to see the skills of other seniors. To become a good physician, you have to be a good listener, to listen to the patient. And to become a good doctor, you have to have both the skills and communication again. As the end on the point, the communication is the key.
Wow. Honestly, I think a lot of future doctors and maybe current doctors can learn a lot from these conversations. I think Siddhant can be a much better doctor today because of the advice.
Yes.
And I think it serves lakhs of medical professionals that do a lot of good to the society because he has the advice. And in India, thank you. In India, because he has the eyes and ears from, I think, very successful medical professionals. Thank you so much, guys.
Thank you.
Thank you.